Okay, welcome you all. Thank you so much for just making time for this conversation and Medmate training with Betsy. And I'll let our fantastic Betsy Weiss talk a little bit more about the importance of this program and what it can mean for people. So I'm handing it over to you, Betsy. Thank you.
Yeah, I'm waiting for Annie Coughlin to be fully connected. She's coming with.
You know what? She's here. She can't, her computer has difficulties, so she can
Okay.
hear and
Okay.
receive, but she can't
Okay.
speak.
So I feel like this is a group of the already committed and very knowledgeable people talking about supporting others as they navigate healthcare. Because I know you all have a lot of experience and in various capacities. I'm not sure whether you all have actually walked somebody through using the tools of Medmate. Um, have have any of you done that? Um,
No.
Byron or Barb or Annie? Okay, hi Annie. Um, uh, so I'm gonna. Um, I think what I'll do. This is going to be a little awkward. I have these slides, and again, I think they're kind of really elementary for this group, but it sort of gives you a flavor of how the origin of the program um, and the tools that we use and what the values are of the program, which I think is important um, as you take this job on or help someone navigate their healthcare. Um, the so I'm going to share my screen and oh, look at that! It doesn't have it. Do I just click share desktop?
You should
No.
be
Okay.
able to,
Okay.
I
Let me.
thought I
I'm
have,
gonna escape my. Currently in full screen mode, but I'm going to go over to not full screen mode and make sure I'm in Medmate. And here we go. Okay, so let me go back to my Zoom and share my screen. You guys are very patient with me. I apologize. And I will share.
yeah, there
Uh,
it is.
can you
Nice.
no, can you see this part?
Yep,
Okay. Okay, this is what I want you to see. And then I'm going to go down there and go to present. Okay. So that looks
perfect.
very, and that's supposed to be your introduction of who you are and what your experience has been and why you're here. But I think I really know that this is a group who values the idea of helping people through the healthcare system. Um, we really make a point of you not needing a medical background. As I look around the room, I think there is a lot of medical background either through personal experience or actual roles in life. The main thing is being willing to listen and being willing to provide support. Um, the role of the MedMate is to assist a member with preparing for their visit, and that means developing questions, getting them to and from the visit, taking notes during the visit, and possibly helping them get the information that they said they wanted out of the visit. Um, and then spending a little bit of time after the visit. What we know is that people retain about 30% of what's said in a medical visit. Um, and I think the reason for that is not because they don't have good cognitive skills, but because it's a really charged environment and alien and not one where people feel really empowered in general. It's really important that we are at the service of the people who have asked us to help them. And by that, I mean that if they don't want us to speak up, if they don't want us to insert ourselves into their relationship with their healthcare provider, that we respect that. And if they do want us to support them, that we determine in what ways they want to hear our voices. These are just a couple of ideas, suggestions for what people should bring to their visit. No surprises here, but it's incredible. I just recently took someone with a chronic arthritis, and we didn't bring her handicap placard. So, so much for that. This is a part of being a medmate, which I think is not necessarily as easy to take on, but meetings with someone before they get to the office is really helpful in understanding what they want to get out of it, the visit, and what role they want us to play. It is astounding to me how often somebody has an appointment and they have no idea why they're going. I don't know why it's astounding to me. I think it because since I've been on the other end of people coming to the office, I always think that they must know why I wanted them to come back to the office. But it's really interesting how often somebody has no idea why they have an appointment. And if they don't have an idea, then helping them formulate what questions they might have that would make them feel like the visit was worthwhile is a real opportunity. And these are just some thoughts about questions to ask to help them formulate questions for why they're going and what they want to get out of the visit. Lots of times offices, especially for new visits, will have a form that they want the person to complete, and oftentimes it can be written in language that is hard to make sense of, and it's helpful to have somebody who has a little more familiarity with that language to help them complete the form. These are some thoughts about questions you might ask your person. What do you want your person to cover if they're seeing a doctor or a nurse or whoever? I think being specific about asking them what they want from us in the visit, and if it's okay to speak up if you don't understand what the doctor's saying, then it's quite likely that the person who's visited it doesn't understand either, and asking for clarification. Is it okay to ask for clarification? It's a good thing to ask permission for. This is an interesting question that was suggested by another organization. What does your provider need to know about you, and in order to meet your needs? And it, again, since most providers have never been in the home of the person that they're seeing, they may not realize that the person that it's a real challenge to get in and out of their house, or that that their refrigerator's broken, or that they can't walk safely in their neighborhood, or whatever. Or that they really don't want to come to the hospital unless they absolutely have to. So that it's an interesting question. How much information you'll get when you ask it is hard to know. These questions about whether you have a power of attorney and whether you have allergies to meds, they're kind of standard questions. And but again, it is fascinating. It's a required question for most healthcare providers to ask about allergies. It's really interesting how often it isn't, that list is not complete, or that somebody has a reaction to a medicine that may not be a true allergy, but is enough to make it hard for them to take a kind of medicine, and that information isn't in their chart. I think it is super important to write the questions down before you go to the visit. What questions or concerns do you want answered? Can you tell your provider what your goals are for this visit, and what barriers there might be for you to receive treatment from them? And that could be any number of things: transportation, cost of meds, difficulty swallowing meds, the fact that you're caring for a partner at home, or some other stress. So the job of the Medmate during the visit is primarily to take in the information that's shared and write it down. This is a real challenge for me. I am not a particularly legible note taker, and one of our goals is confidentiality. And so we set as a goal that if we take notes, that we leave them with the person we go with. And so we want them to be usable to the person. And in order for them to be usable, they have to be in a form that they could read. And normally, I think what I would do is take it home and rewrite it. But that really is something we strive to avoid. We don't really want to take our person's information out of their control and their space. And so if you can do a good job of taking your notes, that's wonderful. And try to put it in a form that the person can understand and read. These are the kinds of things that you might include in your notes, and kinds of questions, again, that you might ask about what is the diagnosis that you're being seen for, that the person is being seen for, and what does it mean? I've had people who have had a heart valve problem and have a very difficult time understanding what that means, or that they have, well, you guys can give us some examples, probably. What can you expect from this condition? Is it going to get better? Is it going to get worse? Is it going to go away on its own? What are the options for treatment? What are the likelihoods that treatment will help? What are the risks and side effects of treatment? And what happens if there is no treatment? And when is my next visit? And this is also something that often is not clear. When you're taking someone to and from a visit, if they use a mobility assist, making sure you know how to use what they're using, either a walker or cane, and if you need some help with training. I think everybody in this room has had training on those kinds of things, but if it's not obvious, the person is often your best source of information. And being clear about whether you can leave the person alone when you're parking your car. And when you bring the person home, goal is to try to get them inside their home, make sure they're safe, and then review the notes that you took with them and make sure they don't have any other further questions. And if you have any worries after the visit, then reporting those to Deirdre is the right thing to do. We do encourage Medmates not to pick up meds without the member present. This is sort of may seem silly, but it's a kind of a safety liability issue, making sure that the person is in possession, is mostly in charge of those medicines. We don't set up pill boxes, and we try not to insert ourselves in the relationship between the member and the healthcare provider. When we say we're a support, not an advocate, in this particular context, we're not pushing an agenda of some sort. We are simply supporting our member, the person we're assisting. And while I think it's okay to ask questions, we are not a source of medical advice. And for some of us, like myself, sometimes that's challenging. I think, if somebody's having difficulty with a medication, I think the message we want to give is, well, that's important to let your doctor know. Do you want me to stay while you call them and make sure you get that message to them that you're having a difficulty, or I can't swallow my medicines. Again, that's really important that your doctor know that you can't swallow your medicines. We didn't mention that at your visit. Let's call them back and make sure the nurse is aware of that so she can communicate, or he can communicate that to the doctor. And just as a review, confidentiality is really, really important here. If we are invited into these visits, there's a level of trust we want people to have that's even beyond what we might normally what we might normally expect of ourselves. And we are not bound by HIPAA like the healthcare providers are, but it is in order for us to be trusted in this role, I think it's critically important that we not share information in any way beyond what our person says we can share. So if we pass information on, even to Deirdre or Tracy, I think that's about somebody's medical condition, I think it's important to ask very explicit permission to do that. And for the most part, there is no one else with whom we should discuss this person's medical care. We have a bunch of digital forms that if you're doing a Medmate visit, we'll pass on to you. And they're really just tools. You're not bound to use them by any means. You may well have improvements that you want to make to these forms. They're all in huge type, so they're readable by just about anybody. But I think, again, if you can make them better in some way, please let me know. And if you have suggestions for things that aren't included that you think should be, let me know. And this is a work in progress for sure. We used some information from Ashby Village in developing our tools, but this is they are a work in progress, and the fact is we haven't used them enough to refine them and make them really work for you. And you may find that you're better off using a blank piece of paper and doing it from scratch for yourself. If that's the case, even that is probably good feedback. Um, so you should let us know about that. I think what I'd like to do at this point is escape this screen sharing thing and um, have you all share a little bit about your experiences in being health advocates, because you've all done it. And as you reflect on what you've heard about being a medmate, how does that fit with what how you've functioned in your role as a supporter of someone else's healthcare um, in the past?
So, Betsy, it's Annie.
Yes,
Can you hear me okay?
perfectly.
Good, good. I have just a couple things to ask, and then I have a whole bunch to say, kind of as my usual nurse hat here. So, my first question was,
Wait, I'm going to get my piece of paper to write things down.
okay,
Go ahead.
was whether the clinics or whatever ever require the patient to fill out a form allowing you to be present and hearing. You know how to share information. Have they ever asked you to do that? And what is the general response of the clinics and physicians to having medmates in the office?
I have never been asked to have some permission
Okay.
from anybody. And I would say the vast majority of people are really grateful to have somebody there to assist a person in note taking and understanding. The responses I've had have been I I would say there has been some neutral response, but I would say the majority of providers have been very welcoming and supportive,
Okay.
not threatened.
Oh, good. Good. Okay. I also just had a thought because it happened to me. I don't know if you're ever taking people when they're going to have a procedure and maybe they might get a little bit of something that makes them not quite so sharp. If just if there's going to be any kind of a device like a sling or a splint or anything that maybe the teaching for the patient could happen before the procedure ever starts. So they could actually retain it or demonstrate it, because that I think gets missed sometimes. So that's just a general comment.
You know, I think that's a great thing to suggest to the person that you're going with, to have them request that. And if they forget to request it, if they've given you permission to speak up, then do so. I think that's totally appropriate and only makes sense. I think that's a great comment.
Yeah. And then let's see, I made a whole bunch of little notes here. Talking to the patients beforehand, that at the time if the physician doesn't bring it up or ask, if the patient could maybe encourage the patient to say, and this would be beforehand, do you mind if I tell you what I heard you say today? So that they get a chance to clear up anything that they might have misunderstood, or just to make sure they've got it right. It's I know we really started doing that a lot, and it was amazing how, like you said, you remember 30% of things. And so it's a great opportunity to get a little bit more than 30% and clear up any miscommunications.
Again, that's an excellent suggestion. And your thought was to review, to ask that question to the person ahead of time, and then if it's okay for you to ask it at the end of the visit.
If they forget to do it, I like to kind of train people to just have that
Yeah.
be their final thing. And then
Could include that on one of the forms, so just as a
yeah.
reminder for people. Yeah.
Another one I think that comes up sometimes is that, like, if patients have had blood work or any testing done, I think, especially now with everything computer, it is really hard to know, because we're not all as adept at the computer as others. But to be sure to prompt your patient to always ask, when should I expect the information? And when should I be concerned if I haven't heard anything? And then if they're willing to share a name, say, who should I speak to? Because when you call and you get the clinic in Wenatchee and all you can get is, the person who answers the phone calls, it's often difficult to connect with the person who really would know your information. And I just wondered how adept a lot of your patients are at emailing their providers, and whether helping would it be a step beyond to help be that person that connects, that types in an email question to people's doctors.
I've certainly done that for people, and I don't feel like that's out of line at all. I mean, you're doing that with the permission of the person and sort of shaping the question or the communication in
Yeah.
their voice. So I think that's completely appropriate.
Okay, great. And then my last question for you was, so when is it kind of understood that, or you talk about it initially, like if Tracy or Deirdre had concerns about the person, would they talk to that person and say, I know you're going to a medical appointment, we're concerned about this, and then maybe share that with me? I guess I would be uncomfortable if they shared it with me and I was the one that had to bring it up with the patient. So how does that work when, Tracy, you'd probably answer that when you have a concern and that they're going to see the provider.
Let me say one thing, and then I'll turn it over to Tracy. I think everyone who requests a ride to a visit, to a medical appointment or something, should be encouraged to use a Medmate. Now, we've had very few people who have been open to this. Most people decline because they feel like they've still got all their brain, and even being told that it's hard for people to remember stuff on their own. It's hard for them, and a lot of people have a partner or a friend who they take with them, and that they don't feel like they need yet another person to go. And that while there's a lot to be said for that, and I think there are some great people who can do this, I think it's a slightly different thing to have your friend take you than it is to have Medmate take you. So that's what I'm encouraging everyone who asks for a ride to a visit to be encouraged to get a Medmate. But that's not really the question you're asking. The question you're asking is more about communication between the Medmate and the staff at Meadow at Home. So I'll turn that over to Tracy.
Right. And, the vast majority of the time, Annie, if there is a concern, it will be, if we as staff are concerned, it will be because a member has told us something that's going on. And so we definitely are practicing that whole piece of confidentiality and just as Betsy keeps reiterating, asking for permission. And so, yes, if there is an outlying concern that we want to inform the Medmate about, then I would just ask for the permission of the member to pass that information on to you so that you could be, do the best.
Yeah, and they're still in control of who knows and
Exactly. And they
Yeah.
might say, no, let me do the,
yeah, good. Okay.
and so that's our practice.
And the reverse would be the same, be true as well. If I see someone who is having more difficulty with stability, say, or I might ask them, is it okay with you if I communicate to Deirdre that you're having more issues around balance, so that when she speaks to other volunteers, they can be aware of that when they assist you. Or the sensitive one is memory and judgment.
Yeah.
And that one's really hard, because people are protective of their autonomy, and if we question their cognitive abilities, they understandably they get defensive. And if anyone has terrific language around this to offer, I would love to hear it. I sometimes, if something got raised at a doctor's appointment, say, it seems like the doctor was concerned that you might be having some minor memory issues. Are you okay with my mentioning that to Deirdre or Tracy? They can say no. I think that, and often they will.
Yeah.
Does anybody else have better language? Okay, Raven,
Yeah.
you're muted, but I
Yep.
think you can.
There we
yeah,
go.
there you go.
I'm not sure that I have better language, but with my mom, we did a couple doctor's visits where she heard something completely different than I did. And I got really concerned and just told her straight up, from now on, you won't go to the doctor alone. And she sort of went, what do you think? I don't know, And I said, no, Mom, even when Byron and I go to the doctor, we take each other with us because I don't always hear everything. So I turned it more on a personal thing, like, it's not just you, it's even I do this. So, and then she was like, oh, okay. So I don't know if that's helpful, and it's also true. Byron and I do that for each other. So,
it raises Annie's point about trying to do some summary, asking doing some summary of the visit with the provider and your person
Right.
together in the room. I think that can have a lot of value, and it's a step that's easy to forget sometimes. So I think it's a really good practice.
Betsy, my just in the past when I've had patients who, they kind of get very defensive when you talk about memory, you're concerned about that. It just kind of gently tossing that safety. I'm concerned for your safety. So you take it away from, I don't think you're sharp enough to, I just want to make sure that you're safe, know what you're doing. So, but I don't have good words for it. I mean, but that's kind of where I go usually. So.
Well, I think you're right that framing it in some way other than that feels less about diminishing them and more about compassion is good. I do think, though, I mean, we face frequently people's I think it's just incredibly threatening to people's autonomy to raise this issue, and it's and there even in the most loving way we
Yeah.
can, they don't always go. They don't always go
Mhm.
along with us. We do have an
Well,
app.
I also think that people are just generally scared to death or that they're going to get dementia.
Yeah.
I mean, it's just one of those underlying things, whether people admit it or have it very often is, an individual thing. But ultimately, I think that's part of the reason why people don't want to talk about it.
You're definitely right, Barb.
You know, I thought I just mentioned too that sometimes in the perfect situation, let's say, I mean, I'll just say something like, I have a concern or I'm feeling a certain way. So it'd be kind of pulling it into me. It's like I'm noticing. No, first of all, it's like, can I say this? I mean, it's kind of like asking permission and actually looking at them and waiting for a confirmation, you know. And then once you get the confirmation, it's kind of like, well, I'm feeling a little awkward, but you know what? What's your perception of your stability? Something
Yeah.
like, maybe like because I'll tell you what mine is, but do it in a way that's just, I have a concern for you, and I'm wondering if how far off base am I here, kind of thing, or something like
That's a
that.
good suggestion
Mhm.
to get them to comment on whether they think.
Right.
The other thing I think is true that people are not at their best in this situation.
Right.
So we're not always, and remembering that I think is important. I mean, if they can't remember it, most other people don't either.
Well, there you go. Let me ask you this. I've got a question that just came to me. Now, I record most of my stuff, like at the doctor's. Like with an iPhone or, an Android or whatever, you've got a pretty simple recording thing. Now, that gets into a whole bunch of confidentiality. And I was just, as I'm thinking, how would I be able to transmit that? Oh, never mind. That would be like,
If they had a phone, it
Yeah.
could be recorded onto
yeah, it
their
could
phone,
be, yeah, yeah.
which could be valuable.
Um, I think that is something that to consider, and I have had I think physicians are a little more comfortable, and healthcare providers are a little more comfortable with this than they used to be. But I
Right.
think there's certain amount of anxiety around it on both parts. So it's something to consider, and something worth asking your person. Is that something they might want to do? Want to talk to their provider about and see if it might be helpful.
I was just thinking of the notes, Betsy. I'm a horrible note taker as well.
Does anybody have some great experiences that they've had that they want to share?
Well, so this is not particularly an experience that I've had, although I've had a few of them that are personal. I wonder, first of all, I think that we should probably all behave as if we are bound by HIPAA, whether we are or not, that's probably the best default position to be. And in
Could you say a
terms
little
of,
bit more, Barbara, about what that means, just so that for
well,
people who
just,
don't know?
yeah, just in terms of the notice of privacy practice that you get handed at every medical thing that you go to, or on an ambulance ride, or you get a notice of privacy practice, and that just explains that you're not going to share any information without the with anyone without the consent of, whoa. Okay then. Without the consent of the person. And so, I think just behaving that way by default, and asking permission is the way to go forward, just generally speaking. And then I forgot what I was going to say about the other thing. So
while you're thinking about that, I'm going to add to it. When I was in practice, this happened a lot more. It happens sometimes around here too, but I would go to the grocery store and people would approach me, and I would have two little kids running around, sticking their hands in the candy corn, and they would bring up a health issue. And if they brought it up, maybe it's okay to have that conversation in the grocery store, but it's probably not great. And what I find happens to me here is I can be tempted to say, well, how are you? Or what's going on? And really, I think our default should be that we smile maybe, but we don't do a lot more than that when we see them in the grocery store. And those conversations don't happen in public space.
exactly. And I, as a former EMT, and seeing people at their worst, and definitely being bound by HIPAA, the same thing applies. In the grocery store, if somebody comes up to me and says, oh my gosh, you saved my life in that car crash, I'm so thankful, it's fine to acknowledge that in whatever way you want, but you don't go up to somebody and go, oh man, I saved your butt in that car crash, right? I mean, that's an extreme, but it's the same kind of thing. And if the person makes the comment, then it's certainly okay to respond appropriately at that point.
But probably best to keep it limited and not add a lot of your own commentary, or
yeah, don't editorialize too much in the grocery store.
I had an interesting thing happen not too awful long ago. We're such a small community, and I found that someone actually expected that because I had knowledge about their condition, I would share that and set in motion a whole bunch of people just by word of mouth. It was really interesting. They were very upset that I hadn't, they were like, I expected people. It was the weirdest thing. And so sometimes if I know it's somebody who's got a really tight-knit group and I know those people are, I will say, do I have permission to share, like that you had a knee surgery? If they say, or, it's really tricky, but I was blown away by somebody who just assumed that information would get out there to people they knew. Like I would say, oh, I took Bobby Joe to the doctor the other day because she was complaining of whatever,
Well, things do have a way of getting out there. It's just amazing. And it's, I would have people asking me questions about some 911 call that I didn't have any knowledge of, and even if I did, of course, I wouldn't say that I did, but I would have people asking me about 911 calls, and they would know more than I did anyway. So
I think when we're in the role of medical medmate, we should not share that information. So even if we know the circle. And I guess the thing that would be, again, I think sometimes it's important to tell people what's expected of us. That in this role, I am bound by confidentiality, and I will not and cannot share your information with anybody.
Yeah.
However, if you're going to get a knee surgery, do you think a meal train might be helpful
Yeah.
to you?
Exactly.
Then you can say, let's let Deirdre and Tracy know
Yeah.
so that they can help set that up.
Yeah.
And that, I think that's totally cool. But I know what you mean. I mean, I think I'm sorry that happened, Annie.
Oh, it was awful.
Here you were respecting the person's privacy, and that wasn't their expectation.
Exactly. Yeah.
Hey, I've got a question on like in the Confluence system, the My Chart.
Yeah.
There's I've been finding that with my mother-in-law, I've been finding that there's a lot of information put onto that after the fact, and it's printable, and it's a whole breakdown of the visit and the meds and all what was discussed, and I don't know if that's appropriate given the confidentiality, but I wonder if you could work in maybe a okay to get the person's information to be able to print it out for them. I don't know, but it's at least a thought.
I think there might be. I think if they ask you for that, that's okay. I think there's the potential for there's way more information on somebody's chart than we need, and I don't know that we want to be accessing too much information, because
that's sort of like right up there with picking up medications.
Yeah.
It's like you just don't want to have access to anything more than you absolutely need to have. And I think in terms of making suggestions to people about how they could access their records, even if it's asking the healthcare provider to print something out, put it in an envelope, and either having someone pick it up for them, in a sealed envelope, or mailing it, or some secure way of getting that after visit summary. Because Brian, like you said, there's a lot of information. I go there and look at my after visit summaries, and it's got all the doctor's notes, and it's really nice to be able to have that information in hand. And I think there's more than one way to get it. And I think just offering that help in whatever way they need it is another way we could go about it.
Good one, Barbara.
And there are people who will print the visit at the time, people who, and just give you the whole thing. But
there's usually more notes that I've noticed after a visit, when they go to chart afterwards. And maybe that's just because I've had a couple of cataract surgeries recently. And so, there's a few more notes in there or whatever, but
well, that's a really good suggestion from the two of you, to ask the provider to print or the nurse, because it's usually the nurse who's end up doing that work. One of them say, would you please send me the completed note? And if they say you can get it off my chart, they can say great, or they can say, I've never been in my chart. Mail it to me. And they can do that.
These are just wonderful, comments and suggestions, and great points, Betsy. I really like the tools that you laid out, and I wish that I would have had this training, you know, because going through with Joe, I definitely got to be like at the end, his nephrologist was like, "Oh, you're coming here again," you know, because I had so many questions and he didn't always have very great answers in my estimation. And so,
Well,
yeah.
and I think all of us could use a medmate. I was wondering, Annie C, will you be my medmate?
I will if you'll be mine. Yeah.
Oh, okay. It's a deal.
Well,
Raven,
this is great. And if are we done, Tracy? Are we?
Well, if people, Byron, did you have another question?
I was just going to say, Raven's my med mate. She asked me. I went to the doctor last week and texted her, you know, or just put the appointment on, and she immediately texted back, said, "Hey, can I go too?" And I went, "Okay, yeah, what a great idea." It didn't occur to me, right? Well, we go, and the doctor did a 180 on me, which was perfect. He like took me a whole different place than I was gonna go, right? And like so, showing me exercises, all kinds of stuff that went, like you say, that I'm thinking
30%.
50%. I'm lucky if I'm at 15%. And so Raven was able to watch and retain the information, and now I have access to it, right? And so yeah, and it seems like a no-brainer, but it really it's I think it's got to be kind of we have to educate each other that of the value of it. Yeah.
Yeah.
Yeah, I definitely, maybe I could figure out how to pull a few quotes out of this session and put it in the newsletter and
Make us
we'll
the poster child, Tracy.
yeah, keep doing some
The poster
promotion.
children. There you go.
Yeah.
Well, you guys have Raven and Byron. You guys have had a lot of experience in shepherding people through this, each other and your
Yeah.
mother and
My in-laws.
And ourselves.
Yeah. Mhm. Yeah.
Yeah.
A fair about.
yeah.
Mhm.
Experience helps. I guess that's. I mean, I think we're really lucky to have this group and the greater group who aren't all on this session. A lot of people have had a lot of great experience, and I mean, just not being intimidated by the setting is so important, and it's so helpful, and so hard when I went with this one older woman who's had a lot of experience with healthcare, but she's not fluent in healthcare language, and she's not and she feels really she's sick and she feels vulnerable, and when she's there, um, you know, to make your healthcare provider your ally is so important. And it's so hard to feel like you're questioning or feeling uncertain about what they're saying when you want them to feel good about you. And it's nice to have a buffer who um, can be a voice that's a little bit more questioning and more.
Well, and I think also, you know, older folks often don't want to question that authority, and that's just the way people were raised, and you know, it's
right.
It's like it's disrespectful or something, which of course it's not, but if you've been raised that way, then it's hard to ask questions, even when they're very simple and straightforward questions, not in the least bit threatening. So I just think it's really important to remember that as well.
I agree. And to get to the question that Annie raised about reception from the healthcare world, again, I think most healthcare providers' main goal is that you leave that room feeling better and more confident about your care, and they don't mind the questions. They're grateful for them. So unless they're, I mean, I haven't had anybody cut me off or be ever. And I don't tell them I'm a doctor.
I bet. Yeah.
Well, fantastic. Okay, I'm going to stop the recording and